Congratulations on deciding to proceed with your joint replacement surgery. Whether you do your own exercise or seek assistance from a physical therapist or other trained professional, movement is key to a good outcome from your joint surgery. By following these recommendations, you'll be moving much better a couple of months after your operation. General lower extremity strengthening will help with all aspects of recovery. Your thigh, hamstring, and buttock muscles are especially key in supporting your future joint. Move as much as possible within your limits of pain and safety. Be sure to do your exercises 1 or 2 times a day, and repeat each exercise for 10 to 15 reps. If any exercise causes pain that does not go away after you're done exercising, then do not continue with that exercise. To do a quad set, tighten your thigh muscle with your leg straight. Hold 5 to 10 seconds, then relax fully and repeat. Glute sets are performed in the same position. To do a straight leg raise, tighten your thigh muscle first, then lift your straight leg to the height of your bent knee. Hold for 3 to 5 seconds, then lower your leg slowly. To do heel slides, lie on your back and slowly slide your heel toward your buttocks. Once you have bent your knee as much as you can, hold 5 to 10 seconds and then slide back to the starting position. You may want to remove your shoe or use a towel under your heel to help it slide better. You can use your other leg to assist for more of a stretch. To do seated knee extensions, sit in a firm chair with your feet flat on the floor. Extend your knee and straighten your leg fully. Hold 3 to 5 seconds in the straight position, then lower your foot back to the floor. To do ankle pumps, place your heels over the edge of a bed, or on a rolled towel or bolster for support. Point and flex your foot. Repeat 20 to 30 times to help circulation. To do side leg raises, lie on your good hip with your lower leg bent. Raise your top leg while keeping your knee straight. Be sure to keep the foot in line with your torso. If this exercise is too difficult, you can alternatively do this exercise in standing while holding on to a counter or ledge. Focus on keeping your pelvis steady as you move just your leg. To do mini squats, place your feet hip-width apart and put your hands on a counter or back of a chair. Slowly lower your hips as if starting to sit down into a chair. Bend your knees about 45 degrees, then straighten back up. Repeat slowly for 10 to 15 reps. To do a standing march, place your feet hip-width apart and put your hands on a counter or back of a chair. Raise one knee at a time as high as you can, as if you were marching in place. Alternating legs, repeat for 10 reps. Movement is one of the keys to your recovery. In the first 2 weeks, your new joint needs regular, gentle activity to heal properly and to prevent stiffness. Use your walker, cane, or crutches just as your therapist instructed. These tools are there to keep you safe while your joint heals. Take short, frequent walks instead of sitting for long periods. Even a few minutes every hour can make a big difference. Remember to follow the specific precautions for your type of surgery. Use the railing on stairs and step up with your non-surgical leg. Remember your hip precautions. Refer to your specific discharge instructions. Following these precautions helps keep your new hip stable and prevents dislocation. If you had a knee replacement, avoid kneeling or putting heavy pressure on that joint in the early weeks. The best thing you can do is keep your knee moving. Regular activity prevents stiffness and helps you regain flexibility. They'll give you the support you need while you build strength. While resting, do not put a pillow under your knee. Either keep your legs straight or elevated on the wedge pillow you brought home from the hospital. You may have already started with your exercise program before surgery. Your exercises are just as important as your medications and wound care. They're the key to getting your strength and mobility back. At first, you will focus on simple movements that improve circulation, reduce swelling, and keep your muscles active. Exercise gets your heart pumping, your lungs working, and helps prevent blood clots. If you have had a total knee replacement, the focus will be initially on increasing the range of motion. Focus on keeping your leg either as straight as possible, or bend it as much as you can, maybe using your other leg to help, as you saw in the previous video. Additionally, after hip surgery you may need to start with more seated exercises to improve hip range of motion. Seated forward bends are to help increase your hip range of motion. Sitting in a firm chair with feet planted on the ground, hinge at your hips, keeping your back straight until a stretch is felt in the front of your hip. Do not do this exercise after surgery if you have hip precautions that include limiting hip flexion to 90 degrees. Hip abduction, or moving your leg out to the side, can be done lying down at first. Keep your knee straight and your toes pointed up to the ceiling while you slide your leg out to the side. As you progress, your therapist will add more exercises to build strength and balance. The most important thing is consistency. Doing your exercises every day will speed up your recovery and help you return to normal activities. Your recovery will be unique to you, but will follow this general time frame. Prior to surgery, establish a care partner who will be able to drive you home and be a caregiver for a few days after surgery. Recovering from a joint replacement is a gradual process, and it's helpful to know what to expect in the weeks and months ahead. Right after surgery, it's normal to feel sore, stiff, and tired. Swelling around the joint is common. Use ice packs and elevate your leg to reduce swelling. Pain medicine helps, but some aching, especially with movement, is expected initially. The day after surgery, pain may increase as the numbing medicine wears off. Keep taking your pain meds as prescribed, don't wait for the pain to get worse. You may feel dizzy or sleepy from the anesthesia for a day or two. Initially plan to move slowly and use your walker. You will be encouraged to walk a few times with assistance. Continue using ice, elevate your leg, and avoid standing for long periods. Over the next 2 weeks you will need less and less assistance to move around and do your daily activities. By the end of week 2, total knee patients should be able to bend your new joint to a 90-degree angle. By weeks 3 to 6, you'll notice improvement in strength, flexibility, and mobility as you continue your exercises and start walking longer distances. A stationary bike is useful to work on range of motion and start to recover your stamina. You should be doing some weight-bearing exercises to improve strength. At this point, some patients benefit from outpatient physical therapy to assist with recovery and continue to make progress toward your goals. Your doctor can help you decide if this is right for you, and will make a referral. As your strength and range of motion improve over the first 6 weeks, you will be able to start doing more vigorous activities, such as light chores, driving, or longer outdoor walks. Everyone's timeline is a little different, and it's normal for progress to happen in small steps rather than all at once. The key is to follow your therapy plan, listen to your body, and check in with your care team if you have questions or concerns. We wish you a smooth surgery and speedy recovery, and we are here with you every step of the way.